Well, here's what a sick cat looks like. The eyes are often real crusty. The third eyelids, those things in the inside, are often up. The third eyelids protect the eye. They're like the eyelids. They help flush dirt out of the eye. But when they're up in a little kitten or an adult cat, it sometimes means they have a viral infection. So a cat may cough or sneeze and have crusty eyes like that, and not want to eat. And if you tint the skin, it doesn't go down very fast. Why that is usually normal skin like ours or like other dogs and cats. You'll pinch it and it'll go right down. If it doesn't, it means the animal's dehydrated. So it usually will stick up in cats with kidney failure that are really dehydrated. Will stick way up, or cats in real trouble. So this kitty's a little dehydrated. It means it's not drinking as much as it should. This is a little wild kitten. It came out from an area south of Gilroy. But it's not, as you can see, it's not too wild, and also it's a little sick. So another thing you look for in a sick kitten like this that are somewhat wild is the gums. If they're little injected like that, little red line, it sometimes means a virus. But basically, if you lift up the lip and you see white gums, then it could have leukemia. Red blood cells, enough red blood cells. It's not terribly anemic like it's got feline leukemia. But it could have just a real severe viral infection. It could have a bacterial infection of the eyes, but that's less likely because what happens is when they have these third eyelids that are up, it usually means a viral infection. So what we did is we take blood in order to see if the kitty has feline leukemia or it has feline AIDS, and then we usually, for the wild kitties, we'll usually give antibiotics to see if they get better. So that's what we'll do. And if a kitty has eyes like that, where real gunky eyes, you can use terramycin ointment in the eyes twice a day in order to see if you can get the infection under control. See, this kitty, he just doesn't feel good. See, it's kind of staggering around. It's just not feeling very good. It's like you or me with the flu. One thing good about one way to evaluate kittens or cats if they have problems is you see if they eat, and this kitten is actually eating just a little bit, and that's a good sign, because whenever animals eat, that means that they may recover. Cats and dogs that don't eat usually have a lot more severe things going on. This cat looks, it's just not feeling very good. It doesn't look like it's seeing very good either, and it's kind of jerking around in there, and you can tell right there by the way he looks that he's out of sorts and not feeling very good. Look at the way he walks around. That's a sick cat, very slow, very deliberate steps, but he does want to eat. Well, he did, and now he's not really interested. But another thing is, this is an FELV test, an FEIV test. When we take blood and we take it in the back, we drop some blood into this reservoir, and a coating goes over this table, flat area. It's coated with enzymes, and it will diagnose if an animal has FALV, feline leukemia, or AIDS. You'll see a dot on one side or the other, and the dot to be negative is right up at the top. So fortunately, this kitty's negative for the AIDS or feline leukemia, and that dot means that it's negative. So that's, at least it doesn't have one of the real fatal viruses, but it just doesn't look very good. So we'll see what happens in the next test. I want to put a slide under the microscope to look at the cells and see if the cells look bad or not. So the next thing to do, sometimes we want to look at the blood cells, the white blood cells, and the lymphocytes underneath the microscope. What that tells us how the cat's immune system is handling the infection, and also if there's any parasites in the blood. So let's look in there. Let's look in the microscope and see what we see. So these are the red blood cells. These are the platelets. Those are in charge of clotting. What they are is less like a little stop leak that you have for your radiator. Those little things will make sure that your blood clots. So if there's a little hole, they go in and plug the hole. So you always want platelets running around your blood, because what they do is they release stuff that helps the blood clot. And your blood, remember, your blood system's a leaky tube. It's not like a regular plumbing fixtures. So here's a big old lymphocyte. Cats, what they do is sometimes when they're have an infection, they'll get white blood cells and lymphocytes that will help them fight the infection. So those are white blood cells, and these are platelets, and these are all red blood cells. Red blood cells look like little frisbees with this little light spot in the middle. That's normal for red blood cells. We look for little dots in the red blood cells. Sometimes there are dots if there's parasites. And we look for a bunch of these if there's a really bad infection. And then we look for those big old lymphocytes in case there's feline leukemia or cancer. Cats, dehydrated cats, you can either put them on fluids, but often veterinarians use sub-Q fluids. What that means is we take a syringe full of fluids and we inject it under the skin, and it's absorbed slowly over the day so that the cat gets the fluids it needs, but it's underneath its skin, so it doesn't have to have an IV catheter and all that other stuff. So here's the fluids. It's 60 cc's. The reason why it's yellow is it's got vitamin B in it, which really stimulates the appetite and helps cats fight infections. So I'll show you what happens. You know, this cat may not like it, and it probably won't, but it's quick. So remember, this is a wild cat, kind of. So I'm going to grab the skin, and I'm going to just inject it under. So we just inject it right under the skin, and the little kitty's not happy. I know. Remember, this is a wild cat. We don't want to hurt him, but he's just not feeling very good. So that's the fluids under the skin, so he can get rehydrated. And then we want to use we're going to give him an injection of the Cavinia. And so do we use this technique? We use this technique because it calms the cat down. Mothers carry the cat like this when they're infants, and sometimes it kind of makes them. Oh, you're a dancer. It's a dancer. I know. I'm sorry. And we're going to give a shot underneath the skin. And this is a shot of antibiotics that lasts 2 weeks. So this cat, even though we've tortured it, now the point is, even though when you torture it, you don't try to manhandle it. You just use your restraints, and then you kind of let it relax, so it has a nice life. So we really don't want to torture cats, but sometimes we have to use restraint in order to get the job done. 24 hours after giving the injection of antibiotics, a little cortisone, some fluids and B vitamins, kitty's eyes, as you can see, have really cleared up. So it was a bacterial infection that was bothering this little kitty, and it was sensitive to the antibiotics we gave. And he's actually purring now. And he ate this morning, so that's really good signs. As you can see, yesterday he was kind of stumbling around, but today he's quiet, but he's not near as sick looking. He's kind of looking around and seeing what's happening. That's a good thing about antibiotics. When they work well.